Hi, my name is Arto Tienaho.
Excellent. I understand you have been diagnosed with an anxiety disorder. Do you have more than one disorder, and is that common?
Yes, actually, I have generalized anxiety disorder, but I also have, I don't know whether it would be diagnosable, but some specific social anxiety as well. But the big diagnosis for me, the one that had the biggest impairment in my life, was panic disorder with agoraphobia. And from what I understand, having more than one disorder as somebody with anxiety disorders is actually extremely common.
All right. When did you become aware that you had a problem with anxiety in your life?
It's really interesting because when I look back as an adult, because as a young child I recognized it on my first day of grade school, grade 1. And when I was called upon to correctly pronounce my name, I remember how anxious I was. I remember how my voice was trembling, how my knees were shaking, and it felt like I was the only one that felt that way. And I recognized that that was a pattern for a big percentage of my life, but it wasn't until I was in my teens that I noticed some other sort of patterns as well. But then in that critical stage of life, through sort of the 20s, when I started to have my first panic attack, and that led to multiple panic attacks, and then panic disorder and agoraphobia, which was a horrible experience.
What were the symptoms and what were the triggers for your panic attacks?
Well, that is the thing about panic disorder in itself can lend itself to so many different triggers, and especially when you add in the agoraphobia aspect of it. And to people that don't know what agoraphobia sounds like, it sounds pretty ominous in just the word, but panic disorder essentially is the fear of the panic attack. It's recognizing when either the physical sensation kicks in that there we go, here's another panic attack. So that can be a trigger. And to some people it could be when their heart rate starts to go up. So whether they're going up a flight of stairs, it can be a physical sensation. It could be when they start to sweat. It could be a whole variety of things physically. It can also be an environment. A panic attack for somebody with panic disorder can be triggered by a place where they've had a panic attack in the past. So it could be a location specific. And so the thing about it is it seems that once you start having panic attacks at a certain place, that it starts adapting itself to more and more places. So it's almost like this vicious cycle. And with agoraphobia, which in, I guess, Greek or Latin is sort of fear of the marketplace, but really it's fear of not being able to escape. So that could be driving over bridges is extremely common, and that's something that I suffered with. I feel the anxiety escalate to a point that was almost unbearable. It felt unbearable. Restaurants, you would not go to a theater or a mall. It would just lend itself to a variety of so many different situations, particularly, even elevators and things like that were extremely problematic.
Okay. Did you share it with anyone? If not, how did you manage and how did it affect your quality of life?
Well, as a young male, as a 20-something male, I did not share it until that very first episode where I actually did pass out at work and was brought to the hospital and got the regular variety of tests, got blood work done, they checked my heart, all of these other things. And hearing that there was nothing wrong with me physically, I sort of almost knew that because I could tell that it was my thinking that was triggering these. And sharing that with anybody, especially at that time, was something that I didn't do. I shared it with my family doctor, But at that time, there wasn't even really there wasn't an awareness about how to recognize anxiety disorders, but also what treatment options really were available. So I hid it. I hid it very well. I still functioned, I still worked, I still did things, and there was a long span of time where I managed, but I didn't flourish. I didn't prosper.
Oh, okay. Was there a turning point? Well, actually you mentioned when you passed out, but was there a turning point where you knew you needed help, and when was that? And could you tell me a little bit about that and that I think you just told me about?
Well, actually, from the time when I was in my early 20s, when I had my first panic attack and went to the hospital for the first time and went to the doctor for the first time, the truth is there was a huge delay. You know, between that time and not really getting a treatment option that was workable for me at the time, and the fact that I was still functioning at a certain level, and I exercised and did some other things. So there was a block of more than a decade. You know, we're talking almost getting towards 15 to 20 years after that moment where I hit rock bottom with panic disorder, where it returned with a vengeance. So up until then, there was discovery, there was ebbs and flows, there was downtimes, there was the odd visit to a doctor and other things, but there never really was sort of that one moment that really made me realize that if I don't do something about this right now, then my life is not going to move forward.
Okay. How debilitating was anxiety for you?
It's interesting because having sort of some of the social anxiety as well, I'll give an example. Making a phone call to somebody would be extremely difficult, especially if I didn't know them. That would cause me a tremendous amount of anxiety, and I might ruminate over that for 2 to 3 hours to build up the courage to do it. So that's showing a piece of how debilitating something like that could be. But when you talk about panic disorder and agoraphobia, now you're getting into a whole new level of being debilitating, because what that sorts to do is really to shrink a person's life, because if you're now avoiding lineups in banks, lineups in grocery stores, bridges, restaurants, and a whole bunch of other things, then life becomes extremely closed.
Okay, what treatment have you had for your anxiety?
Well, there was a time where I did try some medications, and it didn't feel like a good fit for me. I thought that I really wanted to try something else, and it was sort of almost luck and chance and timing, but I found out about some free treatment at the Anxiety Disorders Clinic at UBC, and they were doing cognitive behavioral therapy for anxiety disorders, and I was lucky enough to get some one-on-one treatment over the course of 8 weeks, once a week for an hour, and that really, in the whole scheme of things, really was that one definitive turning point for me.
Okay, and does lifestyle affect your anxiety at all?
Lifestyle affects anxiety. There's absolutely no question about it. One of the things that we all know for all humans, I mean, we all do experience anxiety as human beings, and when it's controlled, it actually protects us and helps us. But we also know that stress is on a continuum, and for some people, when the stresses of a lot of work, not sleeping well, drinking too much coffee, maybe not eating nutritious food and not exercising, that these are contributing factors to having the anxiety maybe trigger again, or to notice the fact that it's, you know, that some of these triggers are sort of, you're feeling it a little more, it's sort of coming back. So lifestyle really does affect a person's anxiety. So learning, you know, on the simple level of learning, recognizing stress levels, learning to manage your stress. What can I do to manage my stress? There's a variety of things you can do. There's progressive muscle relaxation. You can learn diaphragmatic breathing. There's visualizations you can do. You can exercise. You can use your cognitive behavioral therapy tools. You can hang out with some good friends. You can get some exercise. So there really is, as far as lifestyle goes, those are real key indicators. So whether you plan in healthy lifestyle things to help manage the anxiety, but also building the awareness to recognize the things and to know yourself well enough that you don't have to get to that level where the anxiety becomes a huge problem. If you recognize it in the early stages of, yes, I haven't been doing this, this, and this, and I'm now feeling like this, and these are the things in my life that are suffering, sleep, relationships, and what have you, then that is the moment to do something about it.
Okay, wonderful. And what advice would you have for someone that might be concerned about their own self or loved one or friend with anxiety?
The interesting thing is with the idea that for anybody with any mental health condition, that in order for them to do really well personally, the best thing that they can have is a support system around them, and not just people that are empathetic to what they're going through, but actually people that know what they're going through and how to be helpful. So when it comes to recognizing this in a friend or a loved one, the main triggers or the main things that one would notice with somebody is if their behavior has changed somewhat dramatically. They no longer want to do this, or, you know, so it's usually, the indicators with somebody is usually a behavior, and if you know them well, you will recognize when this becomes apparent.
Okay, excellent. And can you get rid of anxiety?
No, you can't. We're humans. We're stuck with anxiety. But that's not a bad thing. That's actually a good thing, because in truth is we can learn to manage our anxiety. So even somebody like me, diagnosed with anxiety disorders, I can manage it. And I can manage it effectively. And the truth of the matter is, once you actually learn how to manage it effectively, you sort of demystify it, because it is the resistance to your own anxiety that fuels it. And so this is for everybody. If you have something you're not doing because you're afraid to do it, but you would really love to do it, then it's probably the anxiety that's holding you back. So you can actually learn to manage it. You can learn to manage it for a specific type of thing, whether it's going on an airplane, whether it's doing some of these other things. But the truth is, no, we can't get rid of anxiety, and we wouldn't want to, because it truly is a survival mechanism for us. But it's like a smoke alarm that is going off from making toast as opposed to there being an actual fire. So learning to dial down the fight, flight, freeze response, our adrenaline system, from triggering, from anxiety, and from these what-ifs or future fear and thinking along those lines. It's something that, no, we don't want to get rid of it. We want to make friends with it.
Excellent. And is there anything else that you would want to tell anybody else who might be watching this video?
I would like to tell anybody that if you have been suffering with anxiety, or if you know somebody that has been suffering with things that you can say that this is anxiety, that there is ways to learn to manage it. And the wonderful thing about learning to manage anxiety, be it something, a specific phobia or just one of the anxiety categories, learning to manage it and sort of mastering it and feeling good about it really is an empowering thing for somebody, and it allows you to sort of reach for more and more goals. So it really is something that that has a huge payoff if you're willing to sort of, if you're up for the challenge, that the payoff is well worth it.
Excellent. Well, thank you so much.